Yes, sir. So, good evening, everybody. Thank you for joining in the session. It is an absolute honor to welcome Dr. Rakesh Gupta, a distinguished ophthalmologist and public health leader with over 36 years of service in the Punjab government. Dr. Gupta has played a pivotal role in strengthening public health systems in India. As a state program officer for the National Program for Control of Blindness, that is NPCB and VI, for 7 years, he helped integrate the school eye screening program into the national framework, benefiting over 9 lakh students and providing 1.4 lakh free spectacles. He has also served as former director of health of health services and deputy director for NCDs in Punjab. Currently, he's the president and director of public health at SPHER, where he continues to contribute to public health, education, research, and policy development. His contributions have received global recognition too, including the WHO Award on World No Tobacco Day 2015, participation in WHO consultations in Geneva on tobacco control policies, and representation at international conferences in Switzerland and Thailand too. He has also been honored with the SBI Award for Exemplary Medical Services and the Punjab Red Cross Award for the leading COVID-19 telehelpline. An alumni of Johns Hopkins University and the University of California, San Francisco, Dr. Gupta is also certified tobacco cessation specialist and a fellow of medical academics. We are truly privileged to have him with us today. Please join me in warmly welcoming Rakesh Gupta, everybody. Over to you, sir.
So I can start with my presentation.
Yes, sir.
Yes, sir.
Okay. Okay. Good evening, all, and thank you, Anurati, for this. CV presenting my CV, and so I'll be talking about ciphers, where I'm working now. The 7 years, more than 7 years have happened when we started the cipher, and then my experience in public health. But first of that, I'll talk about my experience as a clinician, also as an ophthalmologist. It's not moving. Yeah, it's moving. So the Strategic Institute for Public Health Education and Research, it was established in 2018, and for creating a specialized public health force who can plan, execute, and monitor national health programs and public health initiatives for tackling emerging public health challenges. So this is the working. Actually, we have annual reports with us. So this was 2018, 19, and 1920. And what we did was we worked on electronic cigarettes. We banned electronic cigarettes in 2013 in Punjab, but pan India it was banned in 2019. And just before the ban, we had a consultation, and we also sent some recommendations to the government of India. And after that, it was banned, right? So I'll change my spectacles. I think this is too small. Yeah.
Sir, I'm sorry to interrupt in between. Your slides aren't moving.
They are not moving?
No, sir. It moved for a second, but we're back on the first slide.
Okay, okay. So I'll
Yeah, now it did, sir.
Now, do you think it is moving now?
Sir,
Yes, sir, it is.
It is. Okay, okay. Then we also had a consultation on protecting minors from tobacco, nicotine. So that was in March 2019. And we also had some a consultation on reinvigorating the eye banking system, because in my time as a state program officer, we had corneal blindness backlog free cornea initiative in Punjab. So we had a consultation before that. And then the consultation on tobacco 21, again, we had how to protect minors from tobacco control. Then we also celebrated World Heart Day by campaigning on the World Heart Day. And we also invited many heart specialists during that day. And then state level, inception workshop was done on hypertension, preparation and management, how to manage the hypertension. Then we also had a seminar on hypertension, preparation and management. So I think it is a repetition. So we did in November and then in November 2019 and again in 2020. So just to reiterate that why hypertension is important. Then we had a state level workshop on media persons, how the media can help in public health, right? Then seminar on theoretical consultation was there uh, regarding human relationships in managing the substance abuse. So this was another consultation which was held. So these were the consultations we held in 2019 and 2018. So this is the annual report of 2020-21. I think uh, Rohit, we can skip the details in the annual
Okay.
report because you can go through the link to the website,
Sure, sir. Sure,
right?
sir.
So
Yes.
in 2021 we did some consultations. So this is the list of the consultations. You can always watch the index now when you just click on the link of the Cipher strategic. So this is in 2021-22. This is the photograph of the health minister of Punjab and then other participants they were there. So we had a consultation with the restaurant hookah bar. So we worked on hookah bars also. So I'll be telling you all the details about the how we worked on hookah bars in Punjab and Chandigarh. Then we also worked on finalization of trans fat surveillance plan for Punjab. So how to work on trans fats because this is very important not to take trans fat too much to save ourselves from hypertension. Then we also had a workshop on smoking cigarettes, e-cigarettes, vaping, tobacco chewing. This is a gateway to the illegal drug use. So first of all, we start with the tobacco smoking or tobacco chewing, and then vaping, and these are all gateway to the other drugs use, other serious drug involvements. Then we had how why the SDGs they are important in tobacco control. So these are all these workshops we held in 2021-22. Then this is the annual report of 2022 and 23. So you can
Sorry,
just
sir.
yeah.
Sir, sorry for interrupt. Sir, slide is not moving, sir.
So should I then?
Yes.
Uh,
Now it's
is it moving now?
yes, right now in the annual report slide. Yes.
Yeah, this is moving.
Yes, now it's
Okay.
moving. Yeah.
Okay.
Thank you, sir. Thank you.
So this is the 2022-23 report. So you can just have a look at it on clicking on the our website. So these are the consultations we had during 2023, 22, 23. Then we also worked with World Health Organization on OTT platforms. So why the tobacco imagery should not be there on OTT platforms? You know that there's a lot of misgivings on OTT platforms, and then the porn is there on the and the tobacco imagery is there, and people they are seen showing vaping also. Vaping is electronic cigarette use, right? So with our workshop, and it was held in I think April, and in September it was already the notification was issued by Government of India. So these are the two of our achievements actually. So you can just have a look at the consultations we had. We had about 42 consultations, 42 consultations, 22, 23. Then this is the annual report of 2024-25. So you can see that we had about uh, can you see? So actually the without maximizing you can't see, but there must be at least 50 consultations in the year 2024-25. So we also worked with other organizations on charitable projects, like we had a MOU with Tri-City Eye Hospital, SCS Nagar, Mohalli, Punjab. Then Aratrika Eye Care and Research Foundation in collaboration with the Savera Hospital, Moga. Then we had MOU with the National Association for the Blind, Chandigarh, a Punjab State branch. And then we had MOU with Cornea Center also. We had some consultations with the Cornea Center, Dr. Shok Sharma, who is a cornea surgeon. We also mentored interns and volunteers from the University of Petroleum and Energy Studies. This is in Dehradun, Uttarakhand. Then the Chitkara University, Rajpura, they are also sending some interns and the volunteers to us for mentoring. Then we also had some interns from Punjab University, Center for Public Health, Punjab University, Chandigarh, from Arizona College Preparatory High School in Chandler, Arizona, USA. So this is these are our activities, and our mission is to contribute to health and well-being of all people through strengthening the public health education, supporting, developing, and implementing evidence-based public health programs, and scaling up of locally relevant research in India. So this is our mission, and for overall achievement of the health-related goals and targets as defined in the SDGs. So this is our mission, and our vision is that we envision supporting public health actions for accelerating progress towards achieving healthy lives and promoting well-being of all. Cipher has been founded with certain core values which form the base for carrying out its activities and programs. Then we also deal with health equity and social justice, and innovation driven and evidence based operational solutions are also promoted by us. Then we also create leaders who have a passion and commitment and respect for the community. So this is our vision and the values. Then the aims and objectives of the Cipher are to develop, design, and conduct capacity building workshops on need based, diverse public health issues. So you see, we are dealing mostly with the non communicable diseases, and non communicable diseases include hypertension, diabetes mellitus, cancers. Then eye diseases, they are also included in the non communicable diseases. And to promote implementation and policy focused research, and we also strengthen the monitoring and evaluation of the national programs, to establish a technical resource center for public health issues, to develop technical resources like journals, books, and magazines. So these are our aims and objectives. And also we organize or participate in academic or research related seminars and workshops. And we collaborate with the institution, as I already told you, that of repute experts are also collaborated with. And we also receive donations, grants, society for furtherance of our objectives. And we also support, collaborate, and national and sub-national governments. So many of our activities have been recognized by Government of India and even internationally. So my experience in ophthalmology and public health, I was in clinical practice as a general duty medical officer from August 84 to 96. Then I did my MD ophthalmology in Government Medical College, Patiala from December 86 to December 88. Then worked as ophthalmologist in PCMS till October 2009. And I had helped in organizing camps, about 500 eye camps in rural areas basically, and operated upon say about 10,000 operations. Mostly they were cataract surgeries. And in public health, I am since November 2009, and I worked as a DFWO in District Muxar till January 2010, and after that I shifted to the state headquarters. So as SNO, NPCB, that is National Program for Control of Blindness, and National Tobacco Control Program, then I also remained in cancer cell of the Punjab government. Then National Program for Iodine Deficiency Disorders Control Program was there. So I handled that also. And then I was designated as Deputy Director of the NCDs, all the non-communicable diseases. So all the programs held as SNO, they were also under me as DD, as Deputy Director. Then I was shifted as Director Chemical Examiner Lab, and along with that, I had charge of DHS with effect from October 2017 to February 2020. So I superannuated in February 2020, and after that I joined this Cipher. So my important achievements in public health, you can say in NTCP. So there was action on health hookah bars. So there was a NGO by and they filed a case against us. So under that garb, we acted against the hookah bars. We banned hookah bars under Section 144 of the IPC. Earlier it was IPC, now it is BNS. And we declared Punjab as smoke free in 2013. Then smokeless tobacco was banned, that is basically gutka was banned in 2013. Then e-cigarette was banned under Drug and Cosmetic Act in 2013. Then there was ban on sale of the loose cigarettes in 2014. And we also took help of the legal metrology department. Under legal metrology department, if a package is there, you can't break that package, and you have to have about 5 or 6 things to be written on that. So under that legal metrology act, we acted against the loose cigarettes. So WHO World No Tobacco Day Award was given to us in 2015 to the Punjab government, to the state tobacco control cell. Then we also worked on tobacco-free villages. And in my time, about 300 villages, they were declared as tobacco-free. So under National Program for Control of Blindness, as told by Anurita, so there were about 1.5 lakh spectacles were distributed to the kids who had refractive errors. There was regular monitoring under NPCB so that we know and how they are working, how does and we did capacity building of many of the ophthalmologists so that they can do phaco surgeries, vitreoretina, medical vitreoretina. We trained them under glaucoma program. Also, we trained them, and then the provision of instruments, world class instruments was there, and very high end equipment and disposable items were given to all the ophthalmologists in rural areas and urban areas of Punjab. Then in 2015 to 17, we had cornea blindness backlog free Punjab initiative was there, which was appreciated internationally. A paper was also written by Dr. Radhika Tandon on this CBBF. She was our mentor on CBBF. So under cancer cell, we had Mukhyamantri Cancer Rahat Kosh, and most of the private and the government hospitals were empaneled. And we also had we distributed 1.5 lakh funds to each of the cancer patient. And under NIDDCP, that is National Iodine Deficiency Disorder Control Program, we had protocol for checking iodine content in salt. So, and what we were awarded, and some of the achievements are WHO award in on World Tobacco Day. Then it was I represented MHFW for WHO consultation on e-cigarettes in Panama. Then I also represented Government of India for plain packaging in Geneva in 2017. Then there was an award for exemplary services in medical profession. It was given by SBI in 2019. Then the award of honor by the Punjab Red Cross as chief coordinator Pan India COVID Tele Helpline. That was also given in 2021. Then I attended WHO Global Workshop on Flavors and Global Consultation on Novel and Emerging Nicotine and Tobacco Products. So e-cigarettes, they are part of this NENTPs, or the Novel and Emerging Nicotine and Tobacco Products. That was in Geneva and Switzerland. And I also attended a National Thai Conference on Substance Abuse. This was conducted by Chiang Mai University, Thailand. So these are my achievements, and I think these are my contact details. If somebody wants to, I'll share the. I've already shared the presentation also with Rohit, so you can also get it from him. So I think this is all from my side, and I'm open to questions also, if you have any questions. So I'll be answering those questions also. Yes, Rohit.
Guys, do you have any questions so that sir will be able to answer regarding the public health? And if you have any kind of questions regarding your upcoming journey in the public health or digital health, so that sir will be answered accordingly, and you will also get the clarity about your particular domain in which you look forward your career. So please ask questions so that we will.
And students from Chitkara, they are welcome for volunteership or
Right.
internship in our institute. Yeah.
So guys,
So
you
it
can
can be done online also. It
yes.
can be done online also. So you don't have to come here. So it can be done by in virtual mode also.
So I have a question.
Okay.
Like we talked about, and like your organization works on strengthening and towards the causes like NCDs and everything. So I wanted to ask you about your take on health taxes.
Health taxes. I think talk about tobacco taxes if you allow me. The tobacco taxes actually they have increased now. They are considered as the sin products, but effectively the rate is same for all the. I mean the cost of the tobacco product that remains the same. But there's lot of tobacco industry interference. Because of that, some sense is not there. And earlier actually the states they had leverage also. They could impose taxes on tobacco products, but now it is not there. So as far as we actually had a talk on illicit tobacco products about a week ago. And all the consultants, they told me that the effective taxes, the effective rate of the tobacco products, they have not increased actually, even after declaring them as sin products. And there's no taxes or very minor taxes on BDs and smokeless tobacco. So that is the main problem of India. This gutka, pan masala, you see. The pan masala is always mixed with tobacco, the loose tobacco, and it becomes gutka after mixing with pan masala. So I think government should increase the taxes effectively without getting affected by tobacco industry interference.
Thank you
And
so
I think it is same with the fatty with the I mean what is that called? The pizza burgers. What are they called?
junk food.
Junk food. Yeah. So junk food also that should be, I mean, lesser used by the youth especially, because they contain high content of the salt and high content of the sugar is also used in sugarated drinks. So there's a lot to be done on that front also.
So also another follow-up question. Do you really think that online campaigning and awareness actually works?
Yes, yes, because it is aimed at children and youth, and they always access the social media and Instagram, LinkedIn, then X, what was called Twitter earlier. So they always access it. So it is always good because the tobacco industry interference is there through social media. It is there. So we need to. I mean, the public health people, they also need to use this social media in our favor. And
Thank
you
you.
see the OTT platforms. I talked about OTT platforms. So you can see all the movies in the comfort of your home, and a lot of trash is being seen on the OTT platform, and there's a lot of tobacco imagery. In spite of the notification against it, it is still there. The enforcement of the laws is poor in India, as in most of the countries it is. It is the electronic cigarettes, they are banned in 20 in almost 34 countries, but still it is available online. In India also it is available online. And now the oral nicotine pouches, you might be knowing about it. Oral nicotine pouches, they are, though they are not allowed under Drug and Cosmetic Act, but still they are available online and offline also.
But how about the rural population? Because Probably yesterday, I was just scrolling through my Instagram and I came across a video wherein the beggars and the kids,
Mhm.
everybody was having access to
Smart.
all of these things. And I mean, they don't even use OTT platforms and everything. So how have you planned to go about all of this? I mean, how will you implement your I'll say your plan for these people, these kind of people?
Actually, the smartphones, they are being accessed by all. You know that, you know? And even the beggars and the vegetable owners, the vegetable sellers, they have smartphones with them. You see, it is easy to use just by scanning the QR code. You can just pay them. So most of the people, I think my mates, they are maybe uneducated, but they see the movies and the serials on the phone. So I think this access to the social media is there in the rural areas as well, though it is more in urban area. So enforcement of the law has to be there. Some kind of the since as I told you that OTT notification is there since 2023, but still it is not being implemented. The e-cigarette act is there since 2019, pan India. Still it is not being enforced. And most of the police people who have to enforce the law, they don't know about the law.
Yes, sir. Thank you, sir. Any more questions, guys?
So I actually never wanted to bore you with the details of the activities undertaken by the cipher. So there are a lot of activities. At least now we are doing about 40 to 50 activities per year, and most of them they are online. And you can just always cipher. The website link is there with Rohit. So please share with all, and they can just have a look at what we are doing.
So one candidate is looking
Yeah.
for a question.
Kushi
So
has a question.
yes, please, guys.
Am I audible?
Right.
Yes, you
Yes.
have.
So, good evening, sir. I have a question that what do you think that biggest gap between public health policy and ground level implementation in India? Like, what is the biggest gap between them?
I think the biggest gap is the enforcement of the law. So the public health policies, they are always good. The laws are good in India, and the main gap is enforcement of the law. And the awareness of the law is also not there. Awareness about the like junk foods. Everybody thinks that it is okay to have junk food, right? But there's a gap that we need to, as public health specialists, we need to create awareness among the people, and also we need to support the government with the relevant studies also, so that they know that what is to be done. Yeah, I think the biggest gap is the awareness of the law and awareness
Okay.
of the side effects of the what you mean. I mean the junk foods and the, like these uh, all the why all the non-communicable diseases happen because of the excessive use of the tobacco and this alcohol. That is the main cause. And alcohol is being used in rural areas, especially in Punjab.
Okay, sir. Thank you, sir.
So I think Dr. Casey Seni sir also has a question.
Dr. Casey Sani is with us in tobacco control. Yes. Yes, Sani साहब बताइए.
गुड इवनिंग सर.
हाँ जी, हाँ जी. ये सैनी साहब ये टोबैको सेसेशन में बहुत काम करते हैं, मैं आपको बता दूं.
सर
तो ये इन्होंने खुद भी सफर किया है इन्होंने, और अभी ये लोगों की ये तंबाकू की आदत है वो छुड़ा रहे हैं. हाँ जी
yes
सैनी
sir,
साहब, आइए अपने
yes
एक्सपीरियंस.
sir. I am concerned about the surrogated advertisement of the tobacco products, sir. There is a
या.
big challenge in front of us, sir.
हम्म.
As far as I am concerned, sir, I am concerned with tobacco cessation as well as in the implementation of the enforcement of the Code 5 Act also.
हाँ जी, हाँ जी, हाँ जी.
You well said, sir. There is a improper implementation and enforcement of the Kotpa Act, in particularly in our state in Rajasthan. I 100% agree with you. Neither the people are aware about this act, and nor the officers concerned in the Kotpa Act. They are also not doing well in the enforcement of the act.
Yeah.
So it's a big drawback in the government system. But I'm going to be retired from the government services in the next 5 months.
Okay.
Then
Okay.
I am planning to do some
Okay.
proper
Yeah.
work in this area also.
So you
sir.
plan to devote full time to the public health? Yeah,
Yes, sir.
that's good.
Yes, sir. Yes, sir. Definitely.
Yeah, thank you, Sunny
So,
साहब.
जी
अच्छा,
जी
मैं आपको ना वो कॉटपा के बारे में बताता हूँ, जो सिगरेट एंड अदर टोबैको प्रोडक्ट एक्ट है,
जी
उसमें जो टोबैको इंडस्ट्री इंटरफेरेंस कैसे है, तो सेक्शन 4 है, दैट इज प्रोहिबिशन ऑफ पब्लिक स्मोकिंग.
यस
तो
सर
उसमें क्या है, इन्होंने अलाउ करवा दिया है टू, आई मीन, there can be designated smoking areas at airports, in
Yes, sir.
hotels, and in the restaurants where
Yes,
there's
sir.
capacity of the 30 rooms or 30 people can sit.
Yes, sir.
और एयरपोर्ट में बहुत है. और एयरपोर्ट में जब आप वो जो स्मोकिंग एरिया के पास से निकलेंगे तो धुआं आपको सूंघने को जरूर मिलेगा. So second
बिल्कुल
hand smoking is always there. Section 5 क्या है कि जो सरोगेट एड्स है, ठीक है, देयर कांट बी एनी काइंड ऑफ एडवर्टाइजमेंट. ठीक है, सरोगेट ऐड क्या है कि जैसे चैनी चैनी है, चैनी चैनी की ऐड करते हैं, दैट इज पान मसाला और माउथ फ्रेशनर,
यस
और
सर
बाजार में आपको चैनी खानी मिलेगी. ठीक है, सो दिस इज सरोगेट ऐड. और आपने वो देखा होगा कि विमल इलायची वगैरह की ऐड आजकल बड़े
इलायची
सेलिब्रिटीज,
यस सर
सेलिब्रिटीज बहुत ऐड करते हैं. सो दिस इज ऑल सरोगेट ऐड. और कई बार ना क्या होता है कि कलर्स, द यूज कलर्स ऑफ द सिगरेट्स, सिगरेट
यस
ब्रांड्स
सर
जैसे गोल्ड फ्लेक है, और जो पॉपुलर
वॉल
मालब्रो है,
स्क्वायर हाँ
हाँ मालब्रो है, तो उसकी वो है, उसके वो फिगर जो कलर्स है वो यूज कर लेते हैं. So that is
बैकग्राउंड
also,
बैकग्राउंड दे यूज दैट बैकग्राउंड इन देयर
yeah, so
रिटेल
that is also
आउटलेट्स
surrogate ad. और सेक्शन 6 में क्या है कि सेक्शन 6 में ना तो माइनस को आप माइनस ना तो खरीद सकते हैं, ना माइनस बेच सकते हैं, बट इट इज हैपनिंग इन इंडिया बिकॉज नोबडी, जो वेंडर्स हैं वो पूछते नहीं है एज. ठीक है, और विद इन 100 yards ऑफ द स्कूल्स और एनी एजुकेशन फॉर दैट मैटर, एनी एजुकेशन इंस्टीट्यूट, इवन जो क्लासेस हैं, ट्यूशन क्लासेस हैं, उसके आसपास ना आप टोबैको की कोई शॉप नहीं हो सकती और बेच नहीं सकते टोबैको को. सो बट दिस इज हैपनिंग. सो वी सी दैट अगर अगर ये सेक्शन 6 ऑफ कॉटपाई अगर लागू हो जाए ना, तो मेरे ख्याल से 75% शॉप्स तो बंद हो जाएंगी
सर
मिनिमम.
टीवीएल इज द बेस्ट ऑप्शन फॉर द सेक्शन 6 ऑफ
हाँ
द कोड
हाँ,
टोबैको
टोबैको
वेंडर
वेंडर्स
लाइसेंसिंग
लाइसेंसिंग है. अगर जैसे अल्कोहल आप ऐसे नहीं बेच सकते बिना लाइसेंस के, ऐसे अगर टोबैको वेंडर्स की भी लाइसेंसिंग हो जाए तो इट विल बी वंडरफुल. So
यस
we are
सर
working on the tobacco vendors licensing in all over India. So in most of the states, it is now, in many of the states, it is happening. It
यस
started from Punjab, but never actually, we could not pass that. It has been passed by the Himachal Pradesh. Okay.
यस सर
और section 7 है pictorial health warnings. तो जो illicit products है ना, illicit products क्या है, जो smuggled products हैं या नकली जो products हैं, उस पे ये नॉर्मली जो है पिक्टोरियल हेल्थ वार्निंग्स नहीं होती. सो वी आल्सो think we are all asking government of India to enforce the law properly. ठीक है,
यस सर
तो
थैंक
ये
यू सर
कॉटपा के बारे में. हुक्काबाज में क्या है, हुक्काबाज में ये जो चारों सेक्शन मैंने बताया, इसके अवहेलना होती है. ठीक है, सो हुक्का बार पीपल दे अर्न अ लॉट. आप ये बताओ कि ये वो कहते हैं जी फ्लेवर्ड हुक्कास हम सर्व करते हैं, तो फ्लेवर्ड हुक्का के लिए कौन जाएगा 2-2.5 हजार पे साल जो घंटे के, कौन खर्चेगा? एंड वी हैव रेडेड हुक्का बार्स एंड वी हैव सीन पीपल, किड्स कमिंग विद द स्कूल बैग्स इन द आफ्टरनून.
यस
हुक्का
सर
बार्स को वो प्रमोट करते थे. तो हुक्का बार में जरूर कोई ना कोई नशा तो परोसा जाता है, नहीं तो कोई भी इतने पैसे नहीं खर्चता. So nobody will spend so much money on hookah bars if it is only flavors. और flavors तो घर में भी ले सकते हो. घर में आपने देखा है कहीं हुक्का कोई नहीं यूज करता, तो हुक्का बार्स में ये हो चलता है. तो बहुत सारे स्टेट्स हैं इंक्लूडिंग पंजाब, चंडीगढ़ एंड हरियाणा, इवन इन राजस्थान इट इज बैंड, नो.
यस सर इट्स देयर
कॉटपा अमेंडमेंट से वो बैन हो गया. So hookah they should not be served, but the hookah are running, thriving in Punjab also, in Chandigarh also.
Although they are banned in Rajasthan, sir.
Yeah. Still they are thriving here.
Still they are
Because
banned.
a lot of money is earned from hookah. हाँ जी,
Thank you.
कोई
Thank you,
बच्चा
sir.
कोई
Thank you.
पूछना चाहता है? हाँ, या कोई students, they want to ask any question?
So I think there are no more questions, so we can
Okay.
wrap up. So
Okay.
thank you so much, sir, for your time. It was
So have
really
you recorded this consultation
yes,
or not?
yes, sir.
You have recorded it.
Yeah,
Just share the recording with me. I will just upload on my Cipher Health News YouTube
yeah.
channel also, and so that it can be seen by other students also.
Sure, sir.
Yeah.
Thank you so much sir, for your time. It was indeed a great session. Learned a lot about different sections that are already existing but yet to be imposed impactfully.
Sure.
And yeah, we look forward to also joining your organization as volunteers or interns
Yeah.
in coming time. Thank you so much,
You
sir.
are welcome. Yeah, Chitkara students are welcome to our institute. Yeah.
Thank you so much, sir.
Thank you so
Thank you.
much, sir. Thanks a
Thank,
lot. Thank you for your time.
thank you.
Thank
Bye.
you.
So do share the recording with me.
Yeah, sir, we can share. Yeah.
Okay. Thank you. Bye
Thank
bye.
you, sir. Have a good day. Thank you. Thank you, everyone. Thank you for joining. Thank you.
Bye.
क्लास में घुसा, सिर्फ 2 बच्चे हैं, नवनीति है, दीक्षांत। ये अपना पेंसिल क्लास बंद करने भूल गए हैं।